I want to talk to you about this in a very honest and calm way, because pregnancy is one of those topics where there is a lot of confusion, a lot of anxiety, and a lot of misinformation online. Many women start feeling different in their body and immediately wonder, am I pregnant? But then they take a test, it's negative, and they feel even more confused. And the truth is, in very early pregnancy, especially before a missed period, tests are not always reliable yet. At that stage, what often appears first are subtle changes in how your body feels. Changes that many women notice but don't always connect to pregnancy. So in this video, I want to explain the three most common early symptoms that can appear before your period is late, why they happen, how to recognize them, and also how to avoid overthinking every small sensation. Because not every symptom means pregnancy, and learning the difference matters for your peace of mind. Let's start with something important. Every woman's body is different. Some women feel symptoms very early, some feel nothing at all. Some only notice changes weeks later. So this video is not about giving you a diagnosis. It's about helping you understand what your body might be signaling. If you suspect pregnancy, the only real confirmation is a proper test and medical follow-up. But understanding early signs can help you interpret what you're feeling. One of the earliest and most common symptoms of early pregnancy is deep, unusual tiredness. Not normal tiredness, not I slept badly tiredness. It's a heavy, whole-body fatigue that feels different. Many women describe it like this. You wake up tired, you feel sleepy during the day, and simple tasks suddenly feel exhausting. Things that were easy last week now feel like too much effort. And you might think, why am I so tired? I haven't done anything different. This happens because right after conception, your body starts producing large amounts of progesterone. Progesterone is a hormone that helps prepare the uterus for pregnancy, but it also has a calming, sedating effect on the nervous system. At the same time, your body is starting to build a completely new support system for a baby. Blood volume increases, metabolism changes, and energy demands rise. All of that requires resources. So your body reacts by slowing you down. It's like your system saying, rest, save energy. Something important is happening. Many women later realize that extreme tiredness was their first clue. Now, this is important. Fatigue can also be caused by stress, lack of sleep, anemia, or hormonal changes before your period. So, fatigue alone does not mean pregnancy. But when it feels unusual and comes with other changes, it's worth paying attention. The second early symptom is changes in the breasts. This is one of the most common early signs, and it often appears before a missed period. You may notice that your breasts feel heavier, fuller, more swollen, or more sensitive than usual. Some women feel tenderness, tingling, or even mild pain. Others notice that their nipples become more sensitive or darker. And again, you might think, this happens before my period too. And you're right, premenstrual breast tenderness exists. But in early pregnancy, many women describe it as different. Stronger, more persistent, more uncomfortable. This happens because estrogen and progesterone levels rise rapidly after conception. These hormones increase blood flow and stimulate breast tissue growth in preparation for breastfeeding. So your breasts start changing very early. For some women, this is one of the first signs that makes them suspect pregnancy. However, just like fatigue, breast changes alone are not enough to confirm anything. They need to be seen in context. The third early symptom is more subtle but very common: changes in smell, taste, and appetite. Many women notice that certain smells suddenly feel stronger. Perfume, coffee, food, soap, or even natural body odors may become overwhelming. Some smells that never bothered you before suddenly feel unpleasant. At the same time, you may notice changes in taste. Foods you loved may feel strange. You may crave certain things. Or you may lose interest in foods you normally enjoy. Some women feel mild nausea, others just feel off when they eat. This happens because pregnancy hormones affect the brain's sensory centers. Your body becomes more sensitive to protect the developing baby from potentially harmful substances. It's a biological safety system. Not every woman experiences this, but when it happens early, it can be very noticeable. You might wonder how all of this can happen before you even miss your period. The answer is hormones. After implantation, which usually happens about 6 to 10 days after ovulation, your body starts producing HCG and increasing progesterone and estrogen. These hormones spread through your bloodstream very quickly and affect many systems at once: brain, digestion, breasts, circulation, and energy metabolism. That's why symptoms can appear even before you realize anything is different. Now, I want to talk about something very important: Many women start analyzing every small feeling in their body once pregnancy is on their mind. A headache, a stomach sensation, a mood change, a strange appetite, everything becomes suspicious. This creates anxiety. Stress increases. And stress itself can cause symptoms. So you enter a loop. That's why it's important to stay grounded and realistic. Early pregnancy symptoms overlap a lot with premenstrual symptoms. Fatigue, breast tenderness, mood changes, appetite changes. They can happen in both cases. The difference is usually in intensity, persistence, and combination. If you notice these symptoms and suspect pregnancy, the best moment to test is usually after your missed period, or at least 10-14 days after ovulation. Testing too early often leads to false negatives. If the test is negative but symptoms continue, wait a few days and test again. And if you're unsure, a healthcare professional can confirm it with blood tests. If you think you might be pregnant, it's a good idea to start taking care of your body, even before confirmation. Avoid alcohol and smoking. Eat balanced meals, stay hydrated, rest well. Avoid unnecessary medications. These small precautions protect you in a potential pregnancy. Another thing nobody talks about enough is emotional changes. Early pregnancy can cause mood swings, sensitivity, anxiety, or sudden emotional reactions. This is also hormonal. It's normal. You're not overreacting. Your brain chemistry is changing.